Namaskar viewers, hello and welcome to Sansad TV. I am Tina Jha, you're watching Perspective. It's a headline we are seeing far too often now. A young cricketer collapsing and dying of a heart attack mid-game. A banker dying of a sudden heart attack while working in office. An entrepreneur suffering a stroke in the gym, or a seemingly healthy person in their 30s or early 40s suddenly struck by a heart attack, often without warning. Just gone in the prime of their life. Across India, there's a disturbing increase in the incidence of heart attacks among young adults in recent years. As per NCRB data on accidental deaths and suicides in India, 32,457 individuals succumbed to heart attacks in the year 2022, which was a significant leap from the 28,413 deaths recorded in the preceding year. There are also reports citing data indicating that between 2020 and 2023, of which the data is available, nearly 50% of heart attack patients were below the age of 40. Now, this in more ways than one challenges the long-held belief that heart disease is primarily a concern for the elderly. So what's behind this unsettling shift? Is it lifestyle, stress, diet, genetics, or a dangerous combination of all of these? And more importantly, what can we do, you and I, to reverse this disturbing trend? So to help us understand the underlying causes and also chart a way forward, we are joined by two distinguished experts. I'm delighted to welcome on this edition of Perspective Dr. Rakesh Yadav, Professor of Cardiology and Head, Department of Emergency Medicine at the All India Institute of Medical Sciences. Dr. Yadav, glad to have you with us on Sansad TV. I'm also pleased to welcome Dr. Ramakant Yadav, Professor, Department of Kaya Chikitsa, All India Institute of Ayurveda. Dr. Yadav, thank you for your time. Welcome to Sansad TV. Dr. Rakesh Yadav, let's begin the program with you. And since in my introduction, I've already, through data, tried to explain to our viewers how there's a shift in the trend now in as far as the cardiovascular diseases are concerned and the increasing incidence of heart attacks in the younger adults. As someone who's on the front line of emergency cardio care, what is your observation? Have you seen a shift in the trend in also the age profile of now the patients who are coming to you with these problems?
There's two distinct entities. One is heart attack and another is sudden cardiac death. So these all which we explained, the person dying in the field is all sudden cardiac death. Because heart attack generally means it is because of obstruction or blocking of your coronary arteries. Because of that, a certain part of myocardium start jeopardizing and gradually become dead. So it is an acute heart attack. That is entirely a different entity. So these all which we have expressed are some category of sudden cardiac death. So sudden cardiac death has many causes. One of the causes is cardiac heart attack. It's one of the causes. If you go on older age, the cardiac arrest, the heart attack is approximately consists of 80% of sudden cardiac death. But if you come to younger, it consists about 30%, 25 to 30%. The rest is because of other cause. There is some structural abnormality of the heart, which we say hypertrophic cardiomyopathy, arrhythmogenic right ventricular dysplasia, or some wall problem. There is a narrowing of one of your wall. Second group is channelopathies, in which there is abnormality in electrical conduction of the heart. So because of those abnormalities, these persons are prone for sudden cardiac arrest. And third, fourth thing, it may be because of some other causes. You have a heart muscle problem. Because of it, you are more prone for sudden cardiac death. So believe me, more the younger the population who is dying suddenly, it is not only because of cardiac heart attack, which is typically known as myocardial infarction. There are some other causes, and you very correctly pointed out genetic. Because all these channelopathies, structural heart disease, they have a genetic component on that. And you have a cardiac muscle disorder. So it's a very vast majority of the cause which causes sudden cardiac death. And believe me, the younger the age, you have to be more cautious. And how you can predict it? It's very difficult to predict because these patients are approximately 90% are asymptomatic. They have
exactly.
no symptom.
That's the question I was coming to you, because what's worrying to us now is that, and what we are hearing, what we are seeing through news coming in from various parts of the country, is that the younger adults who are being impacted, they look fit. They are active. They are going around with their usual lives. When they are affected by a stroke, they're impacted by a stroke, and they suddenly lose their lives within seconds. So that's the more worrying trend, and that's where I want your perspective on. Are there signs? Are there symptoms, even in a healthy body, that we are often ignoring?
Yes, sometimes you ignore the symptom. The first thing is you have a strong family history of sudden cardiac death. Your brother has died, your uncle has died, your father has died prematurely. So those who has a strong family history of sudden cardiac death, they should investigate themselves before subject to intense exercise. That is very, very important. Second, if you have a previous symptom, suppose while playing you feel dizzy. About 2 years back, you have a history of slight faintness. Don't ignore these symptoms. Third important thing, you have breathlessness. You generally ignore these symptoms. So if you have any cardiac symptoms like breathlessness, like palpitation, sudden onset, like strong family history, like previous history of blackouts or previous history of unconsciousness. So if you have these all symptoms, before subjecting yourself for intense exercise or playing, you have to go to a cardiologist or a physician to rule out that you are not having this problem. And basic investigation is done. Do an ECG. We find abnormality in ECG. If something is there, do an echo, and then only you should go for intense exercise, because these all history, they 80% has some symptom preceding these all things which they ignore.
Right. So we'll try and also understand from you how lifestyle, how perhaps stress is also adding to these health emergencies in the next round of questions. But let me now go for the Ayurveda perspective to Dr. Ramakant Yadav. Ayurveda, Dr. Yadav, for long has emphasized on prevention, on striking a work-life balance. But from your perspective, how do you see the rising incidence of heart attacks, especially among the younger adults in India? And I ask you this because in a population where we have about 65% of young people, the rate at which the heart attacks are striking, it's alarming. It's something to take note of and make sure that we sort of reverse this trend.
If I say that whatever our colleague has said, that many diseases which are especially cardiac diseases which are occurring from various causes, he has already explained. And similar causes are almost described in the field of Ayurveda also, because how these are explained, there is a little bit difference in the explanation. And that is based on the, you can say, dincharya, that is the daily regime of individual, based on the ritucharya, that is the seasonal regime of the individual, and that all things which include maintaining a good healthy routine of your body. And especially if you are not maintaining your good healthy regime since morning till evening, then there is a lot of chance of developing different kind of ailments. Especially cardiac ailments are such conditions. And also there is a condition which is known by the name of Medo Rog, that is in the obesity. That is also considered as a major cause which is affecting the heart of an individual. So in Ayurveda, basically diet related things are there, lifestyle related things are there, and also mild exercise related things are there. If you are not following these balanced principles of these things, then there are chances of developing cardiac disorders most of the time.
Okay. So what kind of dincharya and ahar, meaning the dietary principles, should be followed is something that we'll try and understand in greater detail in just a bit. But coming back to you, Dr. Rakesh Yadav, because I mentioned stress, and I also came across a report which suggested that of the total number of people in the country who lost their lives due to heart attacks, about 50% of them happened to be working professionals, including women, and the incidence of heart attacks was more in women particularly. So stress somewhere also seems to be a big buzzword when we are talking about the heart attack rates which are increasing in the country. So long hours, deadlines, maybe lack of sleep. How big factors are these in triggering heart issues in the younger population in India today?
One thing is very clear: don't over-stress the stress, and don't over-stress the related stress with the heart attack. Means stress is not the only factor, and it has a very minor role.
But is it a significant factor?
The biggest problem with the stress is not direct relation; it is an indirect relation. Once you have a stress, you smoke more, you drink more, you have a lack of sleep, you eat some junk food, you have no dietary pattern of eating, no fixed timing. If you are a diabetic, your diabetic will not be controlled when you are in stress because you don't take medicine properly. Your hypertension. So stress has 90% role is indirect, which is very, very important. So if you are stressful, the indirect effect is much more. Don't say that working hard will create a heart attack. This will give a very wrong information to hard-working people. You can work hard, but work hard with a cool mind, which I think Dr. Nand Kumar will definitely emphasize. I always say, work 24 hours, but relax yourself. Don't take work as a burden. That is the biggest problem. So if you are doing hard work, you are doing 16-hour work with a stressful condition, it is okay. This stress will make you more competent and it will encourage you to work. But without stress, don't change your habit. Don't make a bad habits. Don't start smoking to awake. Don't start drinking coffee, 10, 15 coffees in evening. Then you should be awake. Don't drink pizzas every day. You are eating high salt. You are not measuring your blood pressure. So stress has a majority of the time, stress has an indirect effect. And believe me, those who are stressed, they are obese also. They don't walk. They don't do regular exercise. So yes, it's very important. That's why we always emphasize, do your work without stress. You can do 24 hours, no harm, but don't be stressful. Sleep properly, eat properly, don't smoke, don't take tobacco, don't take excessive caffeine, maintain your weight, have 40 minutes of walk. If you don't walk, just do yoga, 20 minutes stretching yoga and relax your mind. That is the advice I will like to give, but not that don't work hard.
Sure. Before we get more advice on the Ayurveda front from Dr. Ramakant Yadav, in continuation with understanding some of these factors that are impacting us, Dr. Rakesh Yadav, you've helped us understand both the factors which are beyond our control, but factors those that we can manage, and something that you listed out just a short while ago. But are there also invisible risk factors that we are unable to understand in our daily lives? So even when we are not taking any kind of stress, we believe that our body is healthy. Our diet is something which is as per our as per our nutritionist plan. But are there risk factors that we often overlook and we do not understand?
Yes, there's a lot of risk factor. You have a genetically prone. Your father has a heart attack at 45 and you're ignoring. That is invisible, but that is the most important factor, that if you don't do a proper lifestyle, you have a heart disease much earlier. The pollution, environmental pollution, what you are drinking, what you are eating. If you have a lot of toxins in your food, in your water, sometimes people say, no, I will eat a normal water, tap water, that is not harmful for me. But if your tap water is full of the minerals which is toxic for your body, it will harm you. So invisible air pollution, environmental pollution, and believe me, if you are having stress and if you find that your sleep is disturbed, please take a proper advice by a psychiatrist. Make your sleep good. If you sleep well, majority of the time your dietary habit will be well. You will not smoke much. You have not a constipation, and that's an excuse. If I don't smoke, I don't pass my bowel. These all things are related to the stress. So that is very, very important, which you say, the invisible component and side effect of stress, which you don't think that it is because of this, it's also harming your body. And one of the cause of sudden cardiac arrest, mind it, is one of the cause of the sudden cardiac arrest.
Dr. Ramakant Yadav, what is your perspective on factors like sleep deprivation, mental stress, even emotional stress at times that we deal with, and erratic work schedules? How are these impacting the health of our hearts? And I ask you this because in Ayurveda, heart is not just an organ, it is also the seat of human consciousness, of emotion, and from that perspective, how do you look at these superficial factors that we are now dealing with on a daily basis impacting the health of our hearts?
Definitely, whatever we do, it definitely impacts our heart on daily basis. And as far as Ayurveda is concerned, if you will go through the Ayurvedic literature, you will find that there are three major causes of disease, or you can say stress. Those are based on the basically our sense organs. Especially, I will go by the quotation like Asatmendriyat Sanyog, Pragya Parad and Parinam. Asatmendriyat Sanyog means inappropriate attachment of your sense organs with objects. And Pragya Parad means whatever you do by knowingly you do wrong things. That is Pragya Parad. And Parinam, that is the effect of environment on your body and on the mind. So these are the major factors which are responsible for developing different type of stress on our body. And also there is a major thing which is described, that is the how to use the exercise part. Whatever what everybody is asking regarding the exercise, and nobody is going to tell you how much exercise you do. So there is very beautiful description of regarding the exercise in Ayurveda, and the condition is known as balarth. Balarth means you have half of your intensity, you get half of your capacity you can exercise. And whenever you have a sweating on the forehead, and you breathe, you start breathing with the help of mouth, and there is sweating on body parts, then you understand that this is the my limit and I should stop here. So such type of things are described in Ayurveda, and these are the things which are directly or indirectly related to the cardiac disorders which are happening nowadays. And you are finding that a person is working hard in a gym and suddenly he collapsed. So there are many things are there which are found nowadays.
You know, since you mentioned about preventive care, it took me back to the school days when we were taught prevention is better than cure. So in line with that, how early should one start integrating the Ayurvedic practices into our daily lives, which will take care of the preventive care, and in this case, the health of our heart, which is very vital?
I think this should be from very beginning, since school. I would say that if a child is 4 or 5 or 6 years of age, then we have to incorporate all those things. Especially, we have to get them a habit of rising early and getting going to bed early, and in between keep a healthy lifestyle. We should, being a parents, we should keep on vigil on the what is. There is what are the meals the child is taking. So it is from very beginning, and the time has now changed. That once upon a time it was said that ghee, doodh, and many things are there which are considered as very good food. But now the things are changing, because if you are eating ghee and doodh, then there's such type of amount of your exercise you have also maintained. So you have to digest whatever you take. You have to digest that in your body. So this is the major principle, and we should start very early when that child is 5, 6, 7 years. We usually call that leave it. The child is very small, but that should not be the case, and we should start very early.
Absolutely, you're right. And these habits then, when inculcated in childhood, we are unable to get rid of them when the child grows up. In line with that preventive care, Dr. Rakesh Yadav, from a purely clinical point of view, what are some, and if I could say, what are maybe say 2 or 3 lifestyle changes that you believe every young adult in India must adopt starting today, after watching this program perhaps, because when we watch news and when we hear that somebody we knew, somebody died too early because of symptoms which were visible, because perhaps enough attention was not given to, we fret over it, we are worried for some time, but then we start questioning what can we do to make this trend reverse, or maybe in order to save ourselves from that kind of disease. So what are some of the lifestyle changes that you would suggest that people of our age must adopt starting today?
I always say something you do smartly. Number first, buy smartly. Buy those food which are good for your health. Buy good fat, buy good carbohydrate. Don't say fatless diet. It is absolutely wrong to have a fatless diet because you require fat for your body. So buy a good, I always say, cook smartly. Your kitchen should be smartly cooked. Third is work smartly. If you want to work 16 hours, work 16 hours, work smartly. Then important thing, no smoke. You should not use tobacco. Third thing, very moderation of alcohol. If you can avoid it, it's perfect. Then sleep smartly. That is very, very important. If you don't sleep properly, you can never practice all these things. And jog smartly. Whenever you time, shape your body, increase your exercise capacity, and last thing, control your weight. So this is my message. I never say don't eat this, don't eat this. I always say eat balanced diet, which incorporates everything, but it should be balanced diet, it should be moderation, and the eating habit should be with happiness, not with stress that I'm hungry, I want to eat this. No, you should eat with a healthy mind and with a healthy soul. And if you follow these things, I think this is a lifestyle which you can adopt. You cannot be saint, so don't advise any people to become saint. That do this because we have lot of problem in our social setup. Your work atmosphere is never a peaceful, and Tina, I can say you are also in stress. Whatever you practice, every yogachari which practices sometime in stress, this is a common phenomena. So only moderation of your habits and be happy. That is the message I want to give to make yourself healthy, wealthy and wise.
Certainly. So 3 non-negotiables that are coming from Dr. Rajesh Yadav, but the question also is about not just prevention, but early detection, which is key to controlling or sort of reversing the trend, something that we are focusing on. So in that aspect, Dr. Rakesh Yadav, I would also like to ask you about, are we doing enough in terms of early detection? Or do you think in the wake of the rising rates of heart attacks, especially among younger adults, those in the 20s and 30s, is it time that routine cardiac checks must start at an earlier age in the country?
Yes, Tina is absolutely correct. Don't say then I will go to doctor when I have symptoms, when I had a heart attack. Absolutely wrong. So what I propose and what the basic, all the guideline propose, a child when it goes to a doctor for any reason, at least once his blood pressure should be measured. At age of 20, you should get your cholesterol, blood sugar and blood pressure measured. If it is normal at 20 years of age, then repeat it at 30. If it is again normal at this age, repeat at 40. After 40, you have to repeat at 45, every 5 years. If again they are normal, your lipid profile, your blood pressure, your sugar is normal at 50, then repeat at 55, repeat at 60. After 60, I will say every 2 years you have to repeat.
Right.
After 70, every year you have to repeat. Because as your age grows, there's high chances you become hypertensive and diabetic. So if you do these 3 basic things, your lipid profile, your blood pressure and your sugar, I think you will detect early. And believe me, those who have a family history of diabetes, family history of hypertension, I think they should be more, they should do frequently. I think in younger age, 5 years and later on 2 years. So if you monitor these simple 3 blood tests, which is very cheap, I think you can prevent majority of the cardiac disease. That is very true. And one last important thing, if you have any symptoms of chest pain during exertion, breathlessness, swelling in the limb, fluid discoloration, or some pre-syncope, dizziness during exertion, I think it's a time to go to show yourself to a cardiologist or to a physician at least.
I think very important suggestion, and I think based on those suggestions coming in from Dr. Yadav, it's important for us to start treating or taking our bodies seriously before our bodies give us serious reasons to worry about. Dr. Ramakant Yadav, there is also confusion among people's minds that allopathic treatment cannot go alongside Ayurvedic treatment. So through you, I want to understand and help those viewers who are watching us clear that confusion. Can Ayurvedic interventions work in tandem with the allopathic treatments, for instance, after a heart attack, or if you're talking about a patient who requires a long-term cardiac care?
Definitely. Many times when there is an acute condition, then one should go definitely for emergency. But if after the crisis is over, then following that we can go for many preventive measures which are being discussed in Ayurveda also. There are certain herbs also, there are certain medications also, and there are certain practices also like of Panchkarma, which can be helpful for maintaining the health of an individual. And also they can also adopt yoga. Government of India has also given a 20 minutes protocol that is very simple and can be adopted by any individual. So such type of things are advised, and many things we do that we don't try to stop the allopathic treatment which is going on. But in addition, we give which are beneficial to the patient.
I think another important aspect that I would like to discuss with you, this relates to Ayurveda and making it more relevant to the younger population. How can we make Ayurveda more appealing, more interesting for the youngsters? Because we often see the young adults dismissing our traditional practices as being too slow, as maybe boring, or perhaps in their busy lifestyle, they do not have time for the traditional practices. So how can you change their viewpoint and make them adapt to these traditional practices which have been recognized as in tandem with our traditions, of course, but also keeping our bodies healthy, something that we've read about, but we've lost track of it as we grew up?
Definitely, we have to give a lot of effort for that. But there is a clear-cut demarcation at our hospital. We used to see many patients, but none of the patients come to us in emergency. So that is a clear-cut demarcation in the society. And most of the patient, or you can say 99% of the patient which are coming, are suffering from lifestyle disorders or from chronic disorders. So there is a clear-cut understanding, and even now the younger population, they have started coming for their, how can we prevent their disease condition. I have encountered many younger individuals of 20 to 25 or 30 years of age, and they are saying that doctor, I have such and such problems in the family, what I can do for so that I can maintain myself. So such type of awareness is also taking place in the society, and I think the time will come then when a younger population will also understand the utility of this particular therapy. And as far as the slowness of the therapy is concerned, this is not in all the cases. That depends on the condition and the disease. If a chronic
Since you spoke about awareness, I'll take one last question from Dr. Rakesh Yadav on how to spread awareness and how to make sure that our younger population is educated about how to take care of the health of their hearts. Dr. Rakesh Yadav, what role can schools, colleges, other educational institutions, in fact also workplaces play in spreading awareness about heart health? And do you believe that heart education is something that should start early now in the country, and the youngsters should at least know about the basic symptoms and signs, and perhaps then they can act accordingly? Because heart is one area where we see lack of awareness.
I always say heart is a part of your health system. So the health awareness should start from your childhood. It should not be from adulthood, it's from the child. The second important thing, don't be a student of WhatsApp University. That is the biggest problem we are facing. If you want to learn about good practices, go to government websites, go to society's website. Like if you want to hear something, go to American Heart Association, Cardiology Society of India website. You go to government website. You go to official Ayurveda website. What is the biggest problem with Ayurveda we are facing? That people think Ayurveda has a no side effect and they are taking Ayurveda medicine from who are not at all qualified to prescribe Ayurvedic. My personal knowledge, I am making this diabetic medicine. So if you want to eat Ayurveda, go to a trained person, knowledgeable person. That is the biggest problem which we are facing. All the people are learning health from WhatsApp, which is very wrong. Don't read, don't follow these things. Some will say that eat alkaline water, some will say eat acidic water, some will say eat this, blah, blah, you are getting every day. So I always suggest go to official government website. The Indian government website has everything what you want to learn. Lifestyle, diet, everything is there. They are vetted. They are being written by the well-qualified person. If you want to know about Ayurveda, go to Ayurveda official website. That is the biggest problem. So if you want to learn it, you have to learn it. If you don't, I always say every person in this country know about the Bollywood. What is happening in Bollywood is known by everybody. They know Bollywood. What is happening is politics they are knowing. They know neighborhood. What their neighbor are doing they know, but they don't want to know about their health. That is the biggest problem. I always say you have to learn about the disease. You have to, believe me, many times highly educated person will come to me and ask what medicine for BP you are taking. They said, Doctor Sahab, वो लाल रंग की गोली होती है वो ले रहे. And they are educated peoples. They even don't know what antihypertensive they are taking. So I always suggest, please pay your attention on your health, how to make you healthy. Because if you make, and in cardiology, I always say, prevention is the only cure. If your disease, your heart attack happened, it can never be cured. It can be just treated by medicine.
I think that's the most important takeaway from this episode and the discussion we've had over the last 30 minutes. It's important for all of us to know our body well, know the kind of symptoms that our body is actually, and symptoms and signs that our body is showing. At the same time, go to the right medical expert, right doctors to get ourselves treated, because at the end, health is wealth, and it's important for all of us to take care of our health at the end of the day. So with that, we'll have to wrap up the program. Thank you once again, Dr. Rakesh Yadav, Dr. Ramakant Yadav, for your valuable time and for your much needed timely suggestions to us and our viewers. And to you viewers, thank you very much for your time as well. Take care of your health.
To watch more programs of Sansad TV, subscribe to our YouTube channel and don't forget to like and share them.